can see there. They talk about disciplinary action. This is the compact issue that's there. Some of the other things they talk about is just if you want to know stuff about NCLEX information, that kind of thing, the candidate process, all that kind of stuff is there. All right. So just know that it's a valuable page. Students don't, unfortunately, don't look at this a lot because I think we should actually put it in and make everybody look at it, and give them a grade for it or something, so they can find stuff on there. But it is one of those things that you will use as you go forward to actually make your application for licensure. Okay. I'm trying to remember what page, and I can't remember now where it is. I'm bad. They also have tutorials. There's also, let me just put it in here because I can't remember where it is. Also, the National Council of State Boards of Nursing actually has a test product as well called it's under Learning Text, and I can't remember what page it's on. I'll figure it out and send it to you guys. But say you actually went through, because you have to actually sit through a NCLEX review course that's scheduled the last 3 days, December 5th, 6th, and 7th.
Wednesday, Thursday, Friday.
All right. So those you have to come to. All right. The other thing about that is you guys have been paid into it for the time that you've been in the program. So your fee associated with it is going to be less than those students who are, by the time, the new students, because there's something that's taken out in their fees, have already paid for it. This is the last class that has part of that fee that comes out. I did put up the payment portal is already up, so if you want to pay for it now, you can. I sent the information to you guys about register for that one.
How much is it?
I can't remember how much it is, to tell the truth. You've been here for 3 semesters, so it's usually if you've, I think you have 1 semester to pay for. I'll find out for you. But you can actually set up and pay for that portal now for that review course. Now the other thing is that the National Council of State Boards of Nursing has a little review that you can do access for 3 weeks, 10 weeks, 16 weeks, however it is. Don't even do it on 16 weeks, because that's too long to be waiting to take your test. But for some people, just because I schedule my date, you know, I get my sit pass date, and I want to figure out when I'm going to do it, you can schedule it just for that 3 weeks, and I think it's like $39 or $49. So it's just however that's more money people can get into. So just whatever works for you. If you do the review course and you feel comfortable, that's great. Just remember to practice questions. It's always going to be important. The other thing about when you're in your Group A's and Group B's, for the people that are in Group A, you're going to have a senior seminar that's scheduled 1 day in Group B that's mandatory. And then for those students that have Group B, you have 1 day that you have in a senior seminar that's mandatory. During that time, we're going to talk about some stuff about transition to practice, all that kind of stuff that's put out there in research that we should cover with students before we go into practice. So once you get your randomization to A and B, you'll know which day you have to come to those, but they're actually on the schedule. The one for Group A, that's going to be happening during Group A for Group B students is going to be on November 8th. And then for the second group, it's going to be for November 28th. So once you know which your schedules are, you know which one of those days you have to do. Pinning is going to be on the 12th of December. So you will, and it's usually out here at the Trinkle building. So there will be something that comes out a little bit later because they always ask you to do some stuff about your class. So my video person, whoever in this class, will put something together about your group. My video person, they put some things together about your class as a group, and then they also ask you to make thank yous for your family and friends. So that'll actually be going across the screen during pinning. So you'll actually be able to thank the people that have suffered through this with you, right? So, so you'll be able to thank them as they go to your pinning ceremony. All right. As far as class goes, we do have quizzes. We have assessments, because I hate calling exams, because I hate that too. And as we do those, of course, the same kind of process will be in here in the morning, and then I'll do the item analysis, and then you can review them, that kind of thing. Make sure you come and review them if you're having trouble. Don't wait till the end, so I have to hit you in the head kind of thing. Want to make sure as we go along that everybody's doing okay, because we're getting out of here, all of y'all getting out of here, so don't try me like that. I actually went to do a review course for a school in Orlando. Well, I went to 3 schools. I went to Miramar, Orlando, and Tampa. This is the first time I've ever gone to 3 different schools in a week doing an NCLEX review course. But what was interesting is that these group of people, it was so funny when you said, they act like we haven't seen each other for a week. Every time they come in the room, they kiss each other. Just saying. All right? They hug and kiss each other every time they come in the room. Even the guys. So it's just like, wow. I mean, a lot of it is their culture, I know.
That's Orlando.
Exactly. That's what it is. And so, but the thing about it is I was just like, oh my God, my students are doing so great. And you know how you have to look at their scores? And I'm like, oh my God. So this particular school has a pass rate of 13%.
Oh my God.
And I was like, how are y'all still open? That was my first thing. Because I'm not getting that. So I was thinking to and I told, and the thing about it was I told them you have to think positive. And they were talking about it, because they hated the HESI exam. Their school was using it. And they were like, oh, this. I said, you think the test is the devil. But the test is trying to figure out where you need to, how you need to get to where you need to be. Don't be thinking about that. You need to get out of here so you can buy, I told them purses and fishing poles. kind of thing. So I said, this is what you got to do to work on to get out of here. So that a lot better attitude. But it was so funny because I said, I will come back up here if y'all don't pass this test. And we might have issues. So this is the way I'm with y'all. You're going to get out of this class and pass this test, and we're going to have issues. I know how you all live because you put on the paper. so I can find you all now. But none of that. Y'all going to be successful. Y'all going to get out of here. And we ain't going to have any. We're going to have 100% pass rate and make everybody else jealous yet again. Okay, that's the way we're looking at it. So all positivity, no negativity. We're all getting out of here kind of thing. All right. Any questions about content? Because we're going to talk about stuff today too, but any question about where your test is coming from, all that kind of stuff. All right. Now, of course, if you can't be here, you need to do something in the test center, let me know so I can put it over for you. I know for some people, if that's something that helps you, think that might help you as far as testing goes, let me know. I'll put all this stuff over there. I have no issue with doing that. A lot of less problem doing it out here than it is on Del Negro. So, or even if it's something that, because I will be on both campuses, if you're on that side, you can't make it here, you need to do a test over there, call me and I'll put it over in Del Negro Test Center. Always remember you have to take a picture ID, and then you have to schedule it. Because that's the major thing you have to do with testing. But that's on both campuses. Yeah.
I noticed, like, for example, like on the syllabus, it's more per condition instead of chapter, so you're just going to kind of be jumping around.
Yeah, because
just per condition, like
right.
Whatever the condition is, and then we'll just find whatever chapter that goes with.
Yeah, because most of it, I mean, because the respiratory part, most of the stuff that we're doing as far as this particular chapter is going to be lower respiratory and then in critical care, because that's where all of the respiratory failures and all that kind of stuff is. And then I'll let you know in the vicinity of where it is. But pretty much it is looking at conditions, but think about the global piece of what happens with the patient, all oxygenation issues. That's part of the reason why I made a copy of those, and I'll be posting them to the class site so you'll see them in your sections, because really think about what the global piece of what happens with the patient. And then we're going to have some videos that we're going to be looking at, some skills, because the other thing you have to do is there is a lab component to this class. Do you guys have that little blue lab book? Mm-hmm. All right, so there are some things that are for the MP4. You got to do an assessment, which we will do when we do Wednesday. So we'll go over and do those on Wednesday. So you'll get one of the things that's scheduled in there out of the way. We're going to talk about chest tubes in this class. So I actually will bring the chest tubes so you can see the mechanics of what happens with them. And then we'll go over that. And then, of course, you know we have that trait. So there's a video to watch for that, but there's also, sometimes I'll go over and get the mannequin and we bring it over here because I know that fundamentals people are in the lab. And so that you'll actually have a chance to practice some of that stuff in here before you actually go in. Because the thing about it is they want you to practice it all, talk about them, practice them, and then you go and get signed off in the lab, kind of thing. So we'll go over those things as we go along.
Wednesday, regular attire, or?
Yeah, because we're not gonna be in the lab, we'll be in a classroom.
Okay.
Oh, I forgot, they wear uniforms now. That's the
Yeah.
difference.
Do
Yeah,
we
you
have to?
wear- Yeah,
Do we have to?
yeah. I forgot, I was like, oh yeah, that is right. Everybody now wears uniforms to class.
But not our class, I mean. Our class?
Everybody wears uniforms to class.
Oh,
Okay.
So we
When
have to
you go
wear,
to Del Mabra, you'll see everybody who's in a class in a uniform.
we have to wear our uniforms to class?
When we
Will we go there?
You don't have to do that.
Oh, thank you, thank
You
you.
gotta do it when you're in class, when they.
So on Wednesday, wear uniform, okay? Man, I would hate my life.
Are you in that uniform that much?
Yeah, it's just
That is horrible.
annoying. It's hot.
Yeah, they actually, I just thought about that. I was like, oh my God, yeah, we'll be there. So everybody will see you that day. Nobody sees you out here. But,
We're forgotten over here.
yeah, everybody wears a uniform to class. So it's kind of, it's interesting. Because you see, in my head, I'm going like, man, this person ain't going to be able to wear this one long. It's so tight, I don't know how to breathe.
I
They have issues with oxygenation.
I know.
So I see it coming already. It's just madness. All right.
We're grandfathered in, all right.
Or it turns different colors even before they start doing it. All right. I know, I told them that y'all need to get some of
She looked like Morgan.
All right, so a couple of days that we don't have class, of course, Labor Day. And then we have All College Day, which is actually a day we're not supposed to have contact with students, so you won't be here on that Tuesday.
What is that, all college day?
I have to go to stuff and listen to people do retarded.
What day is that? October 24th.
October 24th. Yes, it's faculty day, we have to work, but we can't have student contact. I was like, really? And I hate it, so that's what makes me. All right. Now, if you look at your homepage, everything is set up so that if you actually went here to look at, we're going to be doing respiratory content first. So if you go down to your respiratory area and click, it should bring up all of your PowerPoints. Now remember, you don't have to print out every single PowerPoint. They're there for you to look at, kind of thing. But we'll talk about what we do in the course. So this is our content area that you're going to be focusing on. Okay, so you'll see those as far as what stuff we're going to cover. And then of course I gave you that other thing that kind of talks about the concept. So this is what we're going to cover in respiratory. All right, so you have to kind of know your A&P, which we went over before. All right, so then we're going to look at the disorders that actually have to do with conditions happening with the patient and some of the medications that you're going to see associated with it. Okay, so the disease, you have to know about airway obstruction, so we're going to talk about that, artificial airways. We're going to talk about acute pneumonias. And the pneumonias we're going to talk about are pneumocystis, which has to do with HIV. Hospital-acquired pneumonia, which is now considered a hospital-acquired infection, but it's called HAP. And then community-acquired pneumonia is CAP, so you'll hear about that. And then we have VAP, which is ventilator-associated pneumonia. And then Legionnaire. So those are the areas that we're going to look at. We briefly go over inhalation anthrax, so that's one that you go like, it's not going to be on the test, because I just have to talk about it. Pulmonary hypertension I talk about, it's not going to be on the test, but we talk about it. SARS is something we talk about, not going to be on the exam. Mainly because SARS we don't see a lot of. It was something that we thought we were going to see a lot, but it's more, normally you see, I shouldn't say normally because it's an abnormal thing, but you see it in areas where it's kind of endemic infection, and it's usually in Asia, and we see a lot of it in Canada, actually, because nurses migrate to Canada. So especially Filipino nurses, that was one of the things we saw. It actually happened. So it does happen in the United States, but it doesn't happen a lot. Then we have to, of course, have to talk about tracheostomy. So that's part of the airway issue that we're going to look at. So looking at ET tubes, tracheostomies, those types of things are what we do for patients. We're also going to talk about ARDS, acute respiratory distress syndrome. And just before we even start talking about things, ARDS is like the worst case scenario for patients with respiratory problems. Think about acute, meaning it usually happens with something that is acute in nature. So a sudden onset disease, trauma, those types of things for patients who have ARDS. Respiratory failure is also the worst case scenario that happens with respiratory system, but it usually happens with people who have chronic lung disease. So that's the COPD. Or, don't get me wrong, it can happen for both people, but when you think about concepts, think about when you're looking at a test question, if a person had a trauma, you're thinking ARDS. If it's a COPD, you're thinking respiratory failure. Asthmatic, you're thinking respiratory failure. Because that's the way you got to kind of think about looking at them. Both are issues of hypoxia, because that's what's happening with the patient. But one tends to happen in more of a chronic patient, and that acute kind of gives you the name of what kind of patients it happens in. Okay. We're also going to talk about ventilators in general. I do not ask you about ventilator questions in like vast detail, mainly because if you were working in ICU, you would get a critical care course, and you would do that as a course by itself. So yes, I talked to you about them and what we use them for and why a patient may have to have one, because the issue is if I can't get your oxygen up high enough and keep it there, ventilator is going to be used. So you got to think it's the worst case scenario. I can't keep the oxygenated, so that's why the patient has a ventilator. So there are patients who have assistive modes, meaning that they're only going to give a breath when they need it. Other patients have a continuous mode. That's the main thing you got to think about. We will talk about tidal volume because that's a piece of what, as far as treatments with those patients. But I don't give you, it's not like you got to remember every single thing about a ventilator. So even if the question has a ventilator in it, is it asking you that? No. It's asking you about either a complication associated with it, because one of the things that can happen is that you put too much air in the patient, they end up with barotrauma, what we call it, that you actually cause trauma to their villi, and the patient ends up with subcutaneous emphysema. So that's one of the complications. But yes, it's always associated with a ventilator question. So it's not that you're going to be asking all these things about, should I know if the patient is SIMD? No, that's not what it is about. Okay. Then on the other side, we're going to talk a little bit about empyema, lung abscess. Lung cancer, of course, would be their common disorder. So even though it's something that, and the reason that it's considered on this side, because lung cancer is also one of those things that you can kind of go either as chronic or acute, mainly because lung cancer is a slow-growing tumor for the most part, so people don't really find out about it, usually unless they're getting an x-ray to get something else done. All those people that are going to get knees, hips, all that kind of stuff, end up doing an x-ray, the doctor say, oh, we see something on the chest x-ray, and then find out the person has cancer. But cancer can also be very aggressive, but the reason that you're going to have it in this class is because it's a commonly occurring disease. Same thing happens when you talk about NCLEX. NCLEX will always ask you commonly occurring diseases, because that's what you're going to see in practice, because that's what they do. They ask people who've been working for a year, what are you going to see? So that's one of the reasons we talk about that. Then we talk about pleural effusions, which is usually something that happens in result of another condition. Pleural effusion is never something that happens on its own. It's always the result of another disease or condition. Then we got the things that happen with trauma. So we have pneumothorax. Although pneumothorax can happen without trauma, the vast majority of times it does happen because there's an injury to the patient. And then we have pulmonary embolus and thoracic trauma, so we're going to talk about those. So then we have to think about some of the age-related things. This will come into play when you're reading your test questions. The older a person gets, the lower their oxygen level is. Because remember, there's less function of villi as a person gets older. So it may be normal to have a O2, a PaO2 that's low on an elderly person. It does not change their pH. It does not change their PaCO2. That's the thing to remember. The O2 level, O2 saturation are going to be low because that's something that happens because somebody's 80 years old. So you may have to decipher some of that kind of stuff. Not that you have to go with a patient has respiratory acidosis or respiratory alkalosis, but you're looking at what are those things that are going to tell me I got to worry about this patient kind of thing. Okay, so then we're also going to talk about some of the cultural considerations that you always have to have that based on, you know, it's one of those NCLEX type things. Patient education as far as prevention. For some of these things there are preventative measures. For some of them they're not. Okay, because you can talk to people about preventing lung cancer. You can talk to people about preventing pneumonias. you know, because you can get, you know, your immunizations, deep breathing and coughing, all that kind of stuff after the fact, but some things you can't, and we don't talk about that. And it's always looking at the acute period of care. So you're not talking about long-term care, you're looking at what am I going to do for that patient in the acute care setting. So in the hospital, clinic, wherever it is that you're dealing with your patient. And then of course we're going to have some meds that come into play. All right, most of the time you're thinking about a lot of these, you're going to have bronchodilators are there, right? Because that's something we have to think about, opening the airway. Steroids come into there because it decreases inflammation. Antibiotics because they go with the pneumonias. Okay, so that's part of what you see in the patients. So those are when you kind of get into your medications. There are some things we use for some of the other conditions because beta blockers, your calcium channel blockers, that kind of thing are used with patients who have pulmonary hypertension. So they come back again sometimes when we think about what happens to the patients. Cytokine inhibitors are things that decrease inflammation as well. Diuretics, because one of the other things that can happen associated with some of these, and especially when you talk about patients with pulmonary effusions, is that we have to diurese the patient, get rid of the fluid, help get rid of what's happening with your patient. We talked about steroids, surfactant. There is a synthetic form of surfactant that you give, primarily used in babies, but it can be given to adults as well. You usually see it given to an adult who is not getting better once they have ARDS. That person's still not getting better, still not getting better, still, and the thing about it is, person has a relatively period of time where they don't look so bad, and about 2 weeks later they get worse. And if they don't start improving, we start doing other stuff when we manage the ARDS patients. So surfactant may be something we give to the patient. If they have a embolus, we may do thrombolytics, because remember that dissolves the clot, but then they'll also get anticoagulants to keep new clots from forming, so you'll see that in the patient. And then of course we're going to talk a little bit about chest tubes, because that's thoracotomy surgery, painful surgery, because every time the patient breathes, guess what? Oh my God, I'm going to die. That's the kind of thing patients tell me with thoracotomy. So pain management is key. Good lung up, that's kind of what you remember about patients who have thoracotomy surgeries. We never put them on the affected side, because you want that lung up so that you can actually inflate. You got to think about what am I doing with this patient. So we'll talk about those particular things. So that's one of the things that kind of lets you know the areas that we're going to be covering. Whoops. And then when you get into your PowerPoints, they actually go over different areas. And one of the things that was interesting is that we had some students last semester that didn't know how to put on oxygen or didn't know what the oxygen devices were. But so that's why there's the oxygen PowerPoint there, kind of thing.
You mean like a nasal cannula?
Yeah, they didn't know what was appropriate to use for patients. So that's why you see that oxygen. Y'all looking at me like, whatever.
Oh, if it's a
But it's like you get, because you got to think about, and part of it is, I mean, we do go over the whole process, because when we talk about patients who have respiratory failure, I talk about, you know, if you put them on a cannula, O2 still not getting better. Then you have to put them on a mask, still not getting better. Then you put them on a rebreather, that's still not getting better. And then if you can't get them non-rebreather, it's the closest thing you get to 100% O2. Person not oxygenated, then they need to be tubed. So they didn't know the process. So they ended up saying, can you put oxygen? I'm like, sure, just put it there. Okay. All right, so that's why that's there. And then we have our acute disorders, so that's the information that's there. I do have a little PowerPoint on mechanical ventilation, tracheostomy, because there's a sign off in your blue book about doing trachs. And I have a couple of videos that are totally disgusting, but because they all deal with that. And then I show you a video in class about a patient getting suction, because I just can't even deal with it. But I show it to you in class, because I'm hearing these people, and they sitting there just doing it, and people, sticking stuff down, and they're not gagging, which I don't understand at all how that's possible, but that's what ends up happening. So that's what for your respiratory. Then we also have it for, if you put, no matter if you go to the home page or view all pages, either way it'll do the same thing. So we're going to start with respiratory first, and we're going to go to cardiac. So if you click on cardiac, you'll get all your information for the cardiac section. So all your stuff is there. Also lists, when you see this little thing at the beginning of it, always tells you what stuff we're going to cover for that particular section. Okay? So that way you have all your stuff there on the first page. You don't have to go any other place. Just go to the first page, click it, and then you can go, it'll click under it, it'll show you all the stuff that's there for you. Okay? I try to do that because you know how confusing I can be sometimes. So I try to get better
Yeah, thank you.
at doing this.
Thank you.
Y'all go like, you crazy woman. So now if you go, when you're on your homepage, you will find it for every.
Yeah.
So I was like, I gotta do better. So I tried. I'm trying. All right. I have issues, I know. But now you can do that for any section that's up there. So anything you click on, you're gonna get the same kind of information for it. Okay, so that's all you have to do is click on it. It'll give you all your PowerPoints, any kind of thing that's on there. I will sometimes send you out some other things, of course, too, you know, because I know there's some people more visual. I'll send you some links that you can go to for looking at things on YouTube, because there are some good ones on some of the hematology stuff. And so I will send those to you, okay? Any questions about class stuff, content, that kind of thing? Because we'll be getting it as we go along. All right. Now, of course, you're filling out your form for me, because just in case there comes a time that I can't be here for any reason, I will send you an email out to the class, but I'll also, I'll try to, who lives in Polk County? All right, so Teray, everybody else lives in Tampa or Brandon or in Plant City. Because I have to know, because the thing is if there ever comes a thing where I can't, because my issue is if I ever have a migraine in the morning, driving this way is horrible, because the sun's going to get me. So I just need to know who lives out the farthest so I can start the calling thing. That's my thing. So, but hopefully none of that happens. But we will, just if it does, I will call you, and if that is the case, I will give you stuff to do at home. All right? Because that's one of those things that, in case I have a student issue, y'all can do stuff at home. So it'll be something that's assigned for you there. But hopefully none of that will happen. I've been doing pretty good here lately. So that's a good thing. All right. If you are on the other side of town when I am on class and you need to see me, my office is at Dale Mabry 335. So I will be there on Monday and Tuesday, afternoon and evening with students anyway. So if you're on that side and it's more convenient for you to meet with me one day over there, you can do that as well. My email address is the same, but of course you can send me stuff through Canvas, but if you want to send me stuff through regular email, it's shenderson2@hccfl.edu. And I did try, I have so many emails to go through right now, it's pitiful, but I will get them all cleared out so we're ready to get to me as we need to. Any other questions? Now, of course, you know you got math tomorrow.
Yes.
You gotta go ahead.
Do we have any practice?
Because I know y'all are so crazy.
Oh, that was like a big question yesterday.
Y'all probably going like,
Well, do we have to memorize those formulas, or we will get the sheet it's like a cheat sheet?
no, there's actually, in this particular class, there's going to be one where you actually have to do vasoactive drugs when you do cardiac, but you'll actually be able to use that form with you. The other thing is still always, it's just because I add words into it, you just go crazy.
Really?
It's the same math you learned in LPN school about giving medications to a patient. So the first thing you do is stop yourself, kind of thing.
Stop yourself.
All right, so the vasoactive drips, that kind of stuff won't come until you get cardiac, but you will actually have a sheet of paper that you can use, and I go over that sheet of paper with you because I tell you what to highlight so you can figure out which formulas to use. Now the reason I use that paper, it was actually something that was created after somebody got sued. A group of nurses that were in a lawsuit, and they created this form. Because I used to figure out, when I used to work in progressive care, we had to figure out medications on patients, and then we had to figure out the cow factor and then do all this other stuff. And it's like if you get one thing wrong, because you know, I'm about as anal as y'all are. So if you get it wrong, then you get two different answers. You're like, oh Jesus, what did I do wrong? So then you calculate it 5 times before you give the medication to the patient. It's a safety issue for the patient, but it's aggravating to you as a person, kind of thing. So using this paper makes it universal, but when you look at the paper at first, you go crazy because you're like, what are all these boxes for? And I have to stop you and say, what's up? All right? Let's see how this fits together.
Is that the one online that you put online?
Yeah.
Oh.
So that's like, don't freak out. You'll be fine. I know, you just had to already.
I went crazy.
All right, because
I probably have to